Now that we've discussed the various differences in communication patterns, I'd like to talk about the role of communication in healthcare. Communication in healthcare revolves around the interaction between provider and client. From the biomedical point of view, the healthcare professional relies on the client to provide data accurately and honestly about symptoms and self-care. But barriers to mutual understanding include the client's pain, stress, and fear. There is the fear of the unknown and being in a strange place, surrounded by odd smells and unfamiliar people who are constantly performing painful procedures on you. What does it mean when the nurse asks you to rate your pain on a scale of 1 to 5? In addition, there is generally underlying stress due to illness, family, or the inability to work. Language differences can also be a huge problem. Imagine not understanding what a nurse, teacher, or physician is saying to you. Because of ineffective communication, the patient may not comply, may reject treatment, or may fail to return for follow-up care. Since the majority of the students in this class are either nursing or nutrition students, the focus is generally on those working in the healthcare field. However, cultural competence is important in all avenues of life. This includes education, business, psychology, social work, and many other avenues of professional practice. With that said, if you are a student who is studying something outside of the health field, you should still apply the concepts that we are covering anytime you are interacting with others, especially those with a different cultural worldview than yours. Your text outlines 5 ways that misunderstandings can occur when communicating in the healthcare field. Number 1, a provider can never fully know a client's thoughts, attitudes, and emotions, especially when the client is from a different cultural background. Number 2, a provider must depend on verbal and nonverbal signals from the client to learn what the client believes about health and illness, and these signals may be ambiguous. Number 3, a provider uses his or her own cultural understanding of communication to interpret verbal and nonverbal signals from the client, which may be inadequate for accurate deciphering of the meaning in another cultural context. Number 4, a provider's state of mind at any given time may bias interpretation of a client's behavior. And number 5, there is no correlation between what a provider believes are correct interpretations of a client's signals or behaviors and the accuracy of the provider's belief. Misunderstandings of meaning are common. Just think of all the things we have covered in this chapter that may cause communication problems. The patient's perception of the cause of illness, the perceived quality of food, diet-related folk illnesses, degree of eye contact, gestures, intonation, voice volume, paralanguage, proximity, posture, eye contact, dress style. A brusque or impatient approach on our part may cause a patient to refuse health care, while a patient who smiles and nods may lead us to think that they understand what we are saying to them. Ineffective communication can be serious, often causing non-compliance issues. Often a student or client will not value or follow your recommendations, teachings, or guidance. They may totally reject your recommendations. This often leads to lost credibility on your part, and unfortunately word travels quickly in the health field. It goes without saying that they may fail to return in the future for important services. They may even turn to traditional healers due to better communication and a higher comfort level. Development of an interpersonal relationship is crucial. Do not hesitate to ask your client, student, or colleague about their cultural ways and how they should be interpreted. It is your job as the professional to tailor the treatment approach for each client. A few strategies that increase patient comfort and compliance are being flexible, sharing control, seeking feedback, and demonstrating sincere concern. When the client's native language is not English, the text suggests that the English-speaking practitioner improve their communication by using specific, descriptive, non-ambiguous language. To determine if directions are clearly understood, An open-ended question such as, "What confuses you?" is much more effective than a simple yes or no question, such as, "Do you understand?" The text suggests when and how to use a translator as well. The mnemonic CRASH has been suggested as a useful way to remember the components to cultural competence that underlie effective care. C. Consider culture in all patient-practitioner interactions. R. Show respect and avoid gratuitous familiarity and affection, such as calling a patient by the term sweetie instead of their name. A. Assess and affirm intercultural differences due to language skills, acculturation, and other factors. S. Be sensitive to issues that may be offensive regarding personal biases that may cause miscommunication. And H. Demonstrate humility by apologizing quickly and accept responsibility for any communication missteps. Title VI of the Civil Rights Act guarantees that no health care discrimination should occur based on language. Frequently, non-professional translators are often used, such as employees within the organization, ranging anywhere from housekeeping employees to administration. Sometimes people in the community will also volunteer their time. The inadequacies of these interpretations are numerous, leading to problems with informed consent, patient safety, and noncompliance. If at all possible, professional translators should be used. Telephone interpretation services are often desirable, since it takes the embarrassment of having a third person there out of the picture. For those of you in the healthcare field, I have included a link to the webpage for hospital translation services, which provides professional translation services. One thing to remember when using a translator is that you should always speak directly with the client. You should not look at the translator. It is the client or patient with whom you are communicating. To end our discussion on intercultural communication, I have placed two phrases here that are exactly the same, with the exception of the tilde over the N. Just for fun, and to prove a point about how communication can be misconstrued, do a Google search to find out what the difference is between these two Spanish phrases that look so much alike, if you do not already know. You have now reached the end of the Chapter 3 videocast. Please note that you will not be held responsible for pages 67 after the section entitled Intercultural Counseling to the end of Chapter 3. Materials covered in this part of the chapter are generally covered in your community nursing or community nutrition classes.